nice to see so many of you here again. It feels like it's been a while actually since our last CASM seminar, because the last couple, due to lots of unforeseen circumstances, had to be postponed, rearranged, one of which being Olga's, who's here with us today. So brilliant to have you here, Olga. And as we were just chatting, this is not Olga's first CASM seminar, so welcome back. I was on maternity leave the last time, so unfortunately missed it. It's great to have you here. Thank you so much for joining us. Olga is a professor now, congratulations, of economics at the Yunus Centre for Social Business and Health, Glasgow, Caledonian. Her research focuses on financial inclusion, microfinance, health and well-being, and she's particularly interested in how income is linked to health and well-being, and how financial exclusion, inclusion, financial management strategies mediate this association, both at the microeconomic level, but both in advanced and developing contexts. And actually, Olga, your working paper, conference paper that you did, I think, on microfinance initiatives in Rwanda, was it? That would be, yeah, fascinated to read that. So when that's fully published, we look forward to that. Olga is currently principal investigator of the ESRC FinWell research programme, which explores the connection between exactly that, financial management and health and well-being in vulnerable groups. And it's this project, this research programme, that Olga's going to be presenting on today. So enough from me. I will hand over to you, Olga, if that's okay, if you just want to start sharing your screen again and kick us off.
Thank you very much, Louise, for that introduction. Please let me know if this works.
Will do. Perfect.
Is it?
Yeah, all there, we can see it's fine.
Okay, so today I'm going to present on FinWell COVID. This is the last project of 3 projects in which we've been looking at how, let me see if I can go through the slides. Right. So in which we look at the link between how people manage their finances and health and well-being. So we consider health and well-being in the broadest sense, although we use very specific health outcomes, but we'll come to that later. And we use a mixed method approach. So for the 3 projects, we've used financial diaries. I'll talk more about them later. We've used in-depth qualitative interviews to complement those financial diaries, and we use something called Q methodology. So what happened when the pandemic started? This research has been funded by a COVID rapid call by UKRI ESRC. And what happened was, during our second project, in which we were working with diarists in London, in Lambeth and Southwark, we finished collecting data. We collect longitudinal data for about 6 months. I don't know why this is not there. Shouldn't. And so this data that we collected was when we finished collecting the data in March 2020. So this is just when the first lockdown started at the end of the month. We left people, we knew that our data indicated that people were in very precarious situations. So we're really concerned about what was going to happen to them next, with all the complexity that COVID, its approaches, the shielding, social isolation would bring to them. So we applied to get more funding to continue the research during the pandemic, not only with our FinWell London diarists, but also with the diaries that we had during FinWell Glasgow. So people living in Glasgow. And we have a PhD student in the center, Fatma Ibrahim, and she was working with a group of refugees. She'd also done 6-month diaries with them. So we also embedded those refugees in our sample because they are amongst the most vulnerable. So that was the plan, right? So we started. The objectives obviously were to better understand how vulnerable individuals manage their money. It was supposed to be post-COVID, but it ended up being, as you all know, during COVID. And then we wanted to assess like the financial issues. Oh my goodness, what am I doing? Sorry. I'm dealing with 2 screens here, so I don't know what I'm doing. Okay. So assess the financial issues that came about because of COVID-19 and what were the mitigating strategies that people were using. Like a lot of our diaries had to shield, they had to self-isolate, they had a lot of health conditions that made them really vulnerable. So we wanted to know how this affected them. And then we explored the subjective views of professionals and community participants on COVID-19. We did this using Q methodology, so I'm not going to focus on that today. I'm going to focus on the more financial management strategies. So we used financial diary methods. The financial diaries, we use them in the same way that Jonathan Murdoch from NYU uses it. He was a co-investigator in the project. We basically, during 5 to 6 months, we follow up people, we follow up our participants, and we record every transaction that they make. It's individual transactions, so from an individual, and it will be all the income transactions and all the expenditure transactions. We record where the income is coming from, we record when it's done, we record on how they spend the money, so all that. We managed to recruit, I know that a lot of you here have been doing research during COVID, and this is a very difficult project to recruit people for, because we're looking for very vulnerable groups. We need a lot from them, so we need from them to create these budgets, to take a note of every transaction that they make. We need to be with them for about 6 months, which are 7 ultimately, because we have a baseline interview. So we require a lot from these groups, and it's really hard to recruit. We managed to recruit 29. We had a little bit of attrition, so we finished with 23 diaries that completed either 5 or 6 diaries, depending on their choice. And we had 17 in Glasgow, out of which 6 were refugees and 6 in London. So what we end up collecting, what we end up with is a database, a big database of all the income and expenditure transactions, and that's what we look at. So this time we've collected over 9,600 transactions for these 23 diarists. And at the same time, every month, we kind of talk to them, and we talk to them to see if they've had any what we call life events. Life events meaning, serious events that might have happened in their lives. We always focus on debt, we focus on housing issues, we focus on income changes in employment, and then social support and family networks, because those in previous projects have proved to be really, really important for how people manage their money and manage shocks, with COVID being one of the biggest shocks ever, right? So we every month we interview each of them, and we've ended up with 135 interviews. And in those interviews this time, we also included like health status outcomes, like we use the SF12 and the Biosca, which are actually public health scores. And in that way, we've been able to see how their health progresses during their changes in income and expenditure across time during the pandemic. We started very fancily thinking we would be going to be able to collect data, with fancy apps, and also we tried to video call people. Well, none of this happened, because we discovered very fast that our participants didn't have access to good broadband, so video call was out of question. They wouldn't download the apps. A lot of them were not very tech savvy. So even though they might have smartphones, they didn't know how to use them very well. So, quickly we realized that that was not going to be possible. So all the interviews were done by phone, like regular mobile phone. And then we used text. Some of them used emails. Some others just dropped hard copies of things in the university, and WhatsApp was the main strategy to communicate with them. So to complement and to make more of the financial diary data that we were collecting, we also did qualitative in-depth interviews. We conducted one-off interview with 9 participants. And this was when we already knew what the main themes that were emerging through the diaries, what we were seeing, right? And we did 7 with people who were living in Glasgow, including 2 refugees, and 2 with people living in London. And what the themes that we were already thinking about and seeing that were emerging were changes in the financial lives of participants. Those were very clear due to the change that we all had to make. We all had to adapt in different ways. Changes in the use of some financial products, not a lot, but there were some. And then the changes in the mitigating strategies that people used to make in cliff edge moments. We call cliff edge moments of change that can spiral, spiral downwards very quickly, like the situation. So, divorce, losing a job, or being diagnosed with a serious or long-term health condition, all these kind of changes that make you more financially vulnerable, but can also affect your life very fast. So, sorry. Okay. So for data collection, for the diaries, we did a baseline questionnaire. We had a first meeting with them. We collected social demographics and also their financial situation. We compared when we'd left people in Glasgow and people in London in previous projects. Then we did the financial and health diaries with them for 5 or 6 months. So we used to meet them every month and do these, even though we were collecting sometimes weekly financial data, because it was proving very hard to, on the phone, get these financial data in a rigorous kind of way. So sometimes we had to call them weekly and had these transactions noted weekly, which was good for everyone, I think. But it was time consuming. And then, oh my goodness, sorry about this. I'm just not very sure what I have on. Let me see. Okay. So, and then we had a final questionnaire in which we did the last diary, and then we just made sure that we would record all the changes in the circumstances of the diarists. So who were our diaries? Our diaries were recruited from our first 2 samples in Glasgow and London. So we had that advantage that we could go back to people who wanted to be contacted again for a similar project. They already knew what it entailed. I'm not sure if we would have been able to do it, with people who hadn't done it before, but they all had done financial diaries. They knew what it was about. So it was fairly easy. And the diaries were diverse because that was what we were looking for. We were looking for seldom-heard individuals that, have difficulties in voicing their lived experiences, and they needed to be financially vulnerable, which means not only low-income individuals, but also some moderate income individuals that find themselves in situations in which they can, as I say, their condition can spiral downwards very quickly, depending on what happens to them. And they were living in Glasgow and in the Lambeth and Southwark boroughs in London. And we had 9 partner organizations during this project that you can see there. So who did we manage to recruit? So mostly female, so mostly women. We had managed to recruit more men, but they were the ones that dropped out sooner. Then we recruited between 25 and 64 years of age, 18, so more than half, or nearly 3/4 of the sample received means tested benefits, so universal credit or housing benefits, child benefits. 16 have a non-British background, 3 do not speak English, and the interviews and the diaries were conducted either in Spanish or in Arabic. 9 are either employed or self-employed, and then 7 are key workers. So this being cleaners or working in social care or in the NHS. 9 lived with dependent children at the time. There were others that lived with children who were not under 18, but were kind of equally dependent, particularly after the pandemic hit. A lot of adult children went back to their parents' houses, so that we saw that a lot. So these boomerang children coming back and kind of relying again on their parents for support. And then 11 registered as disabled, and 23 with so either they had COVID-19 themselves, and particularly at the beginning of the pandemic, because they were in key worker position, they continued to go out, or a very close proximity experience of COVID-19, this being very close friends or family. So we work on a social determinants of health framework. In our previous projects, we found that income and when I say income, it's not only income, it's also income stability. So it's not the level of income, but it's like the income is stable. And there's employment. Those are the most important ones. Then housing becomes a huge issue as well, with people that are in vulnerable groups, a lot of them in council housing or housing associations. Then access to health services during the pandemic has been an immense problem, particularly for people who had long-term health conditions, cancer patients, as you know. Nothing else to say on that. And then social support become a really important coping strategy in moments where when these groups had financial problems in our previous projects. So that was also important here, but maybe lost the importance that it had previously. So let's jump into the results. So their financial situation before COVID, the one we knew about. So we know that for the financially vulnerable, for people who haven't got a lot of income and that are, even if they have moderate income, are in an unstable and uncertain financial situation, insecure. The most important worry is uncertainty. So not knowing what's going to happen, how much money they're going to get, from which sources, if there's anything's going to break down and they're going to need to pay for it. That's the main, the main thing. So we have Tony that described this very well, and he said, my financial situation has not been good for a long time because I'm on benefits, etc., and I can't work due to my illness. But I mean, basically, you were managing to get by. You sort of knew exactly week to week what you had to do, what bills you had to pay, and things like that, what you had to get to manage your money before the pandemic. And it's more existence of getting by than actually living as such independently. And then Tony goes on to say how during the pandemic, everything has changed and things have become a lot more stable. Like he didn't know if he had to stock up on groceries, which actually is an issue for them because they don't have the money to stock up for groceries. Or if they had to, how he was going to get hold of his doctor if he needed it, if his chemotherapy treatment was going to continue or not, and all that uncertainty added to worries. So what we've learned from other ThemeWorld projects as well is that people who are living on low incomes have actually really, really sophisticated financial lives, and they have to make decisions that most of us don't, but they are on top of the decisions they make, and the decisions are very rational, economically rational, considering the choices that they have. So they have restricted choices, therefore their decisions are sometimes not ideal, but that's because probably the ideal decision couldn't be made. So we know that, we've learned that. So we had a look at what had changed in terms of financial management, what we thought would have changed on how people have managed their money during the pandemic. So on average, the monthly number of transactions that were reported by per participants were similar to pre-pandemic levels. So they were around 75 a month or so. So on average, it was similar. However, the difference of standard deviation between people who were better off and worse off increased. The diarists made financial decisions every other day in our previous samples. So we knew that financial decisions, and we call financial decisions, decisions that involve money, obviously, and that are linked to financial products. Being this formal or informal. So, a loan from friends and family would be a financial decision. So getting a loan, paying back a loan, paying for insurance, getting some money to save or putting into a savings account. What else? Pensions for those who have them. And, secured loans as well. So some of them, I think a couple of them had mortgages. So during COVID, we found that the number of financial decisions that people had to make were lower. And we have speculated. So I have to say that these results are very preliminary, but I thought this would be a really good sounding board because I know a lot of you have been conducting research with similar issues. So, but we speculate, and we think there's because of two reasons. The first one is that for very vulnerable, our diaries previously, the main strategy that they had to deal with illiquidity, so to deal with times when they didn't have enough money, was to borrow, and they borrowed in particular from friends and family. But during COVID, this didn't seem to be the case. They decreased a lot. And one of our diarists, Anna, says, but when the pandemic hit everyone, we can't meet, we can't see each other, and everyone have no money. So it was really, really bad, right? So the social networks that usually offered social support, social and financial support to our diarists were equally hit, and they were equally vulnerable. So nobody had money to kind of face the situation. And also what we've seen a lot is that help, social support, a lot of the time came in kind. So people would give another one, you know, food, usually cooked food. They would go and buy medicines for them. So it wasn't money that was being exchanged anymore during the pandemic. It was more things. It was in kind. So this is one of the things. We also speculate with difficulties of people in dealing with online, with, you know, borrowing and repaying. And also there is these the holidays, you know, the financial holidays in repaying mortgages, council tax, unsecured debt, etc., that were taken up by most of the diarists. So when we, in this Finwell COVID, over half of the sample said they wouldn't be able to cope with a £1,000 financial emergency. This was when we first asked them in March 2021. And the main coping strategies of those who could were relying on family and friends and depleting savings. So again, I think this sample, because of how we've sampled, was less, so it was, if you want, less vulnerable than the sample that I had in Finwell, London, but it's more heterogeneous. There are people that are moderate incomes, they're doing relatively well, they have their mortgages, etc. And then there's people who are very, very in extreme situations. And I think this heterogeneity, we need to work more around this. We need to find more about what has happened with each group. So around 60% of the diaries that we were working with, they had unsecured debt when we met them. And this included family, but then also overdrafts, credit cards, and buy now, pay later schemes, which hopefully will be regulated soon. So what happened when COVID, you know, the first moments of COVID, what was being felt by a diarist? So even for a more financially secure participants, the uncertainty of the, you know, the pandemic brought financial worry, particularly at the beginning of, in the first lockdown in March 2020, the recollections are of, you know, uncertainty, what's going to happen, how am I going to get an income? You know, the charity that I work for might not be able to go into the furlough scheme. Am I going to get any money at all? Those that were self-employed were, you know, equally panicking about their situation and their sources of income. And the worst part of the uncertainty happened before we met him. We first met them, but you know, we still could see some of the effects of the mitigating strategies that they'd used. So that gap between having to start shielding for those who had shielded and socially isolating, working from home for the others, and when social support actually kicked in, so when furloughs, the universal credit uplift, help from the councils, the food parcels, the charity support, and then also more organized social support networks that I'll discuss later. And that gap was the gap that actually made people really worried and panicking, and through which they had to maybe take the most the worst mitigating strategies, the worst coping strategies, more aggressive, those that are going to have long-term consequences on them, such as, you know, asking for a loan, or going without food, or, you know, having to stop shielding. I'll go through them later. And we know the way during the time in which we were talking to our diarists, they had huge difficulties in accessing and dealing with, you know, basic services. And this, we've seen this throughout so also in the two other Finwell projects, like, these people have a lot of challenges that they have problems to access, you know, the NHS, the, you know, housing, either housing association, the housing council, the landlords, you know, they just have a lot of problems in people dealing with their needs, right? And and actually listening to them. Banks as well. So some of the banks, we've got reports of, credit card providers just ignoring people when they should be giving them like repayment holidays by law. So also internet providers, they were really hard to get hold of. And some people had, because of problems in adapting to online banking, they had issues with, their internet being cut. And then they had, they were maybe 2 weeks without internet because they couldn't reach the internet provider and tell them that they'd already paid and that it needed to restart it and things like that. And then another thing that was quite difficult for them to manage was switching to online banking and grocery shopping. And some of them did just not do it, as we'll see. So in terms of financial behavior, on average, the financial diaries reported that since the start of the pandemic, their finances did not change much. So it was at the end. We stopped collecting data in November, between September and November 2021. And some of them said, on average, they said that their finances had not changed much. However, again, there's the standard deviation is high. So there was, for some of them, the finances changed a lot, and for others, they didn't change at all, or they were better. But the overall health and well-being average was minimally worse, right? Initial mitigation strategies combined with welfare support was, we think, what prevented important changes in terms of income. Now, big changes are coming now with the with the spiraling inflation, but also with the end of the living cost crisis and the end of the things like universal credit uplift, which, we managed to get the first month off for some of the diaries, but and there are plans on how they were going to compensate for that money. But we haven't got data to analyze more longitudinally. So some of the decisions that were rightly made, we think, by some of our diaries was actually to those who had more insecure employment positions and did not have the right to furlough or were self-employed, they immediately made changes and they became key workers, a lot of them going into cleaning. So they became cleaners just to make up for the income that was being lost. So we had a photographer, for example, she was self-employed, and there were no longer weddings or parties. So what she did was she became a cleaner. So a lot of these decisions were being made, and we thought those were really interesting because they were made at speed. They knew they didn't have enough savings to last during that gap until financial help, welfare support, or social support could get to them. The furlough, the universal credit lift, other help from councils, etc., that was really helpful. And it really worked in creating a safety net for our diarists. Another thing that really worked was the ability to be to restructure loans, to ask the bank for holidays on also the councils, not only from debt, secured debt, but also unsecured debt, etc. That was very good because people were able to kind of restructure their expenditure until they found a new equilibrium. And also people found alternative social / financial, but as I said, the transfers are not cash transfers, they are in-kind transfers, usually of food, support networks. And for example, what this tells us, so usually what we had were groups of friends that would meet and would lend money to each other, even if they were living apart, etc. So that happened a lot in our previous TeamWorld projects, and social support networks were a main mitigation strategy for any cliff edge moment. However, this time it's more like organized groups. So people were organizing themselves, for example, in disability, WhatsApp groups, Facebook groups, groups of refugees, but all this was through WhatsApp and Facebook. So they were a lot more organized because they saw that it was in the news, I don't know if you remember, but, a refugee died in her flat with her baby, for example, here in Glasgow. There's also, a lot of disabled people were left on their own to deal with their means. And that created, like a general conscience of we need to defend ourselves as groups. So as groups of disabled individuals, as groups of immigrants from particular countries. So for example, Latin Americans would have groups of Latin Americans and Africans, North African, South Africa, Sub-Saharan Africa would be the same. And then in terms of financial behavior, this sums up quite well what they did, I think. So Alana was telling us, because I've still got food in my cupboard, I've still been able to provide a roof over our head. I feel it's a struggle. It is a constant struggle and it is a constant worry, but I don't feel poor because I still have that. By making all these choices, we can still provide the same sort of things, because all we've done is tighten our belts and making obviously wise choices to get by. And they made a lot of choices which were they were economically rational, very rational, even though they might have consequences in the future. So, however, as I was saying, there's heterogeneity in our sample. There's people that are slightly better off, and there's people that are in very extreme situations. And for those who are in extreme situations and really financially vulnerable, they had to make the really tough decisions. So some of them had to continue working, even though they had been required to self-isolate. So a lot of the cleaners, they would get no pay if they didn't work, and they had no savings. So, you know, and they had no food in their fridge. So there wasn't even an option. It was like somebody in my flat, they're usually sharing flats as well with other people who are equally vulnerable. And they, you know, if somebody's sick, somebody has COVID-19, the whole flat is asked to self-isolate, but they just don't do it. They all go out to work, because if not, they're not getting any pay. So that happened in our sample quite a bit. And, you know, they recognized it was exposing everyone to COVID-19, but that was their only option, really. They'd reduced expenditure, including on groceries. So people went on hungry for a while until, you know, food parcels got to them. And even then, some of them weren't halal, or some of them they didn't cater for food allergies. So that also became an issue. They took on more unsecured debt, pay now by later schemes and you know, overdrafts and credit cards. They did not shield when required to shop for groceries. So some of them, they could not afford to stock up. So even though they should be shielding because they had, you know, health conditions that, you know, prevented them from going out, and they could have, they were, you know, highly vulnerable to COVID. They had to continue going for groceries because they couldn't afford to kind of bulk buy groceries. And then they had to accept plenty of help from social networks. And this sounds good, but sometimes there is a need to reciprocate, particularly when their ties are not very strong. And these were not very strong ties because they were ties based on, you know, Facebook groups and WhatsApp groups. So, you know, they brought food to your door whilst you had COVID-19, but you knew that this was going to have a compensation that you would need to reciprocate in the future, right? So that brings also another kind of anxiety and worry and affects people's mental health. So these mitigating strategies had consequences on the health and also financial consequences later. So some of our preliminary conclusions, and these are really, really preliminary, but what we think is like individuals are still dealing with the decisions that they had to make, particularly the loans and the social support that requires this, you know, type of reciprocity or compensation. We think welfare support has played a crucial role, and we think in, you know, so I'll leave it there. But yeah, it should continue, or it should be, you know, we should think about this transition towards a non-pandemic world, because we're still in a kind of transition. And I think we should be focusing on supporting people during their transition, particularly the most vulnerable. We should create awareness of support services and also making them more accessible for the more vulnerable. And this is a finding and a you know, conclusion that we've continually repeated, not only in terms of now it's really difficult to access, you know, the NHS, for example, but there's also for this or diarists, there are language issues, there are cultural issues, there are, you know, different types of issues that make it very, very hard, so disability issues that make it very hard to actually access services. And that becomes quite problematic because it excludes them from solutions. Promote good, meaningful and flexible working conditions. This is crucial because then if not, people have to work informally, high-risk jobs in which, you know, both mental and physical health are at risk. So, and we've seen this very clearly during the pandemic. support ways for people to manage cash. I think we're budgeting loans, interest-free right now, and make informed financial decisions, providing financial advice, but not only financial advice, you know, at a one-off point in time, but to have more contextual, more trusting relationships between financial advisors and people who are in financial trouble, making this financial decisions in cliff edge moments, really. Housing becomes really, really important. So people who were living in precarious housing at the start of the pandemic, you know, some of them with long-term health conditions, asthma, for example, were living in damp flats shared with 12 other people. Those participants, you know, have really struggled during the pandemic. They need certainty on how their housing situation is going to evolve, and also processes need to be, you need to speed up those processes. Some for the housing association, for the housing sector, a lot of demands have been made in the in-depth interviews of more involvement at the beginning, you know, more involvement with the community, seeing what the tenants needed. Some of them were there shielding without food, for example, and it was like, they say, well, nobody knocked on my door. And then finally, you know, this ideal of we should foster more collaborations and coordinated networks between public and private community support services, just to make the network, the support network a little bit stronger. So thank you, that's me. I'll stop sharing.
Thank you, Olga. Where are you? I've lost you. There you are. Perfect timing. I could have listened to you all day on that. That was absolutely fascinating.
Away also.
That was absolutely fascinating. Thank you. So important and so alarming in so many respects, I think. Yeah, just the, you know, the trade-offs that people are having to make to protect their health, you know, versus sort of securing, you know, versus sort of, you know, ensuring financial security. And I think which really just, I guess, just points to the woeful lack of, you know, formal financial support and protection, doesn't it? So for some groups, you know, for particularly vulnerable groups, those not eligible for the furlough scheme, and so much more. I'm going to throw it out to the audience straight away for questions, comments, and like Olga said, you know, they're at a preliminary stage of doing the analysis, drawing together the conclusions. So I think Olga very much welcomes your feedback, your thoughts, your comments, even if not questions, and is very keen to use this session as a bit of a sounding board, as she said. So